Good afternoon. My name is Philip Osehobo, MD, PhD, and FACP, member Association of Nigerian Physicians in America, Georgia chapter, currently Chief Medical Officer and Vice President Medical Affairs of Spalding and Savon Grove Hospitals. I thank you for the honor and privilege to share my experience as a senior healthcare executive on mental illness and well-being during this pandemic. It is well documented and known that healthcare providers and the ancillary support system are going through unprecedented mental health disturbances following the care and the aftercare of COVID 19. These illnesses span from insomnia, lack of sleep, to anxiety, panic disorders, irritability, and sometimes refusal to come back to work. How do we manage and mitigate these concerns? We do know that in an ongoing pandemic, there is no end, particularly when there is no cure or any discussion of an end to the crisis. What we have seen from my own experience is there are two ways that seems to have helped in helping our colleagues and our providers in managing the mental health fallout from this crisis. First of all, every leader and every unit manager or every supervisor need to have two skills honed in to help their team members. First skill is emotional intelligence. Emotional intelligence is the ability to, first of all, be self-aware of and also be able to show empathy and develop skills to understand what people are going through. Emotional intelligence and resiliency, which is the second arm of my conversation and dialogue today, have been shown to help with mitigating the effect of mental health. What is resiliency? Resiliency is, in a layman's term, is the ability to bounce back. When you stretch a rubber band to a limit and it bounces back, that is a bit too much way to describe resiliency. Our ability to face adversity and internalize it with our belief system and then react based on the consequences of that adversity is what is called resiliency. How do you develop resiliency skills? First of all, you need to be present in the moment. Acknowledge what the adversity is. Then we need to be able to think through all the positive things that could have happened, irrespective of the negativism that is around you. This is where our ability to look back to our experiences that have helped us in the past to cope becomes very important. Next, we have to learn to let go physically, which pretty much means moving away from the situation if possible. And then we have to be able to let go mentally, which means the ability to forget what has happened and then be conscious enough to come back and say, I can beat this. Sleep, exercise, and a good meal will help in all of these measures I have just described. So, emotional intelligence as well as resiliency are very skills that we can all learn in order to manage this pandemic crisis when it comes to mental health and well-being. Obviously, we do need some expert care. That is when you will need to see a psychiatrist or a psychologist, and if needed, be on some pharmaceutical medication if the non-pharmacological approaches I just described does not work. Learn to listen with empathy. Learn to be present at the moment. Learn to counter what you're seeing with some positive history or images of the past and look forward for a positive end. I hope this has been useful. Thank you again for the opportunity.